Good morning again, everyone, and welcome to the social work and healthcare breakout session, which will be a conversation with social work and healthcare professionals. And this morning we will be discussing when social work and healthcare becomes political. And so when I say political, I don't mean partisan, but I do want to emphasize that we have the need to embrace civic engagement as a part of our comprehensive approach to our caring professions. So I am Dr. Jessica Hare, Vice President of Outreach here at American Promise, and my background is actually in social work. And I always describe myself as a political social worker. And so now I will introduce our panelists. First, I will start with Ms. Sarah Butts, onto my far right, who is the Director of the Public Policy at the National Association of Social Workers, headquarters office in Washington, D.C., and NASW is the largest social work organization in the nation, representing the interests of over 700,000 social workers nationwide, with 55 local chapters in states and U.S. territories. Sarah is responsible for leading the Association Public Policy, Political, and Legislative Affairs agenda, overseeing field organizing work at both the national level and with NASW chapters, political candidates fundraising and endorsement efforts, as well as developing and advancing the goals and objectives related to influencing the executive branches of government. So Sarah, we welcome you to the panel.
Thank you. Thank you.
Next, we have Dr. Charles E. Lewis, to my left. He's the director of the Congressional Research Institute for Social Work and Policy, which is known as CRIS. And during his time on the Hill, serving as Deputy Chief of Staff and Communications Director for former Congressman Adolphus Ed Towns, he was very instrumental in creating the Congressional Social Work Caucus with the idea it will be a platform that will allow social workers to have more of a voice in Congress. And while on the Hill, as the staff coordinator for the Social Work Caucus, Dr. Lewis organized briefings for the National Association of Social Workers, the Council on Social Work Education, and the Society for Social Work and Research. And in 2012, he founded CRISP, which is a 501c4 nonprofit, nonpartisan organization to complement the mission of the Social Work Caucus and to ensure its presence on the Hill as congressional member organizations. So welcome, Dr. Lewis.
Thank you.
And then to my right here, we have Dr. Marie HenselderKimmel, who is a gynecologist who retired after 24 years in practice in New Jersey. She was inspired by gridlock and healthcare policy to engage in citizen advocacy to address the overpowering influence of money in politics, and is the volunteer leader of the New Jersey State Chapter of American Promise since its inception in 2017. Dr. Kimmel is also one of the leaders who began an initiative for healthcare professionals for American Promise after our last NCLC, and had written testimony accepted for the February 2020 House Subcommittee hearing on the amendment resolution. So welcome, Dr. Kimmel.
Thank you very much.
And lastly, we have Aliya Bhatia. Aliya is the Executive Director at Vot+ER. And Aliya was drawn to the connection between healthcare and democracy through the combination of being raised by parents in the medical field and various defining experiences while studying, teaching, and working on housing and health initiatives. She earned her master's in public policy from Harvard Kennedy School and is a graduate of the School of Foreign Service at Georgetown University. She started her career as a high school educator and then as a strategy consultant at the Boston Consulting Group. So welcome, Aliya. So to kick off our panel, I would like for each of you to take a few minutes to talk about the connection between democracy and health. And I'll start with you, Sarah.
So let me just say what a privilege it is to be here with you all today and to represent the social work profession that works across so many different settings. There really is no community-based setting that social workers are not working in the front lines. And the last couple of years has just been an unbelievable time for our profession and the clients that we serve, really all of society. NASW has one of the most vast public policy portfolios of any DC-based organization, and certainly of any workforce association. We do advocacy for social workers and also for our clients across all these settings. And it's just amazing in our society that we have to advocate so vehemently for people. And I spend a lot of my time making sure that we're able to be compensated, that our reimbursement is enough, which it isn't, and that our pay is enough, which it isn't, and that we can access the education that's required. A terminal degree to practice social work is a master's degree, plus at least 3 to 5 years of continuing education, supervision, and training. So to me, the social work profession is the exemplar. The social is fundamental if we think about other workforces. And this is not to minimize all of their contributions, the nurses, the teachers. I mean, I could go on and on. But there's something that's fundamentally wrong when it's so difficult to get these basic changes. I mean, even right now, during a public health emergency period, when it's very clear that we have a crisis in the country and that people are suffering with mental health, behavioral health, and just meeting their basic needs, we can't get quick action to address these issues. And part of it is that there's money in politics. I will say that NESW does have a PAC, a political action committee. Only members can donate to our PAC. I oversee that. We go to PAC fundraisers, so we do the work on the Hill, the programmatic work and advocacy. We also help to fund campaigns. And I'm often there alongside private business and industry. And it feels crazy sometimes because we may be there advocating for the underserved, for homeless people. And I have to do my pitch right next to the execs in business, and we don't have anywhere near that kind of money. So that's been kind of mind-blowing to me. So I think that there's obviously a critical role for us all to play, for the profession to play, and that we need to kind of think collectively about how to improve our system and improve life chances, opportunity for all of society.
Yes. Thank you, Sarah.
I'm going to take a little bit of a meta view, and that is, I think of democracy as everyone having a voice, and that voice should be equal, political equality. And when as Sarah has mentioned, when there's certain segments of our population, whether it be industries or various different other special interests, let me put it that way, when their voices are heard more clearly on Capitol Hill than the voices of everyday people, then the access to the methods of maintaining health and achieving health once again are not equal. They're not equal across our society. And that doesn't mean universal health care necessarily. It means taking care of the chemicals that go into our water so people aren't sickened by those. But it's taking care of air pollution and the various industries that maintain the pressure on Congress to deregulate things that help control air pollution. It's access to medications and the costs of medications. We did just see a little bit of movement on Capitol Hill with new legislation with some drug price reforms for Medicare, but they were really only a little bit of what's needed. And part of that reason is people are speaking up, so something got done, but not as much got done as possible because, believe you me, the pharmaceutical companies and the insurance companies are in there, just as Sarah said, with their money in the campaign funds and their pressure on Capitol Hill. So I think that there's a real, our health and our democracy are really intertwined. And if we don't encourage, as practitioners of healthcare services, if we don't advocate for our patients to speak up, because the more voices there are adds up to more pressure. We don't all have the money to put in there, and it shouldn't be the money that determines what happens on Capitol Hill. But the more that we advocate for our own health, just like we get a patient to buy into a treatment regimen, whether it be exercise or medication or whatever it be, we have to, I think, educate our patients to participate in democracy as part of maintaining their health.
So Dr. Lewis, I want to come to you because I know that you do a lot of work on the Hill as a social worker, and then I'll get to Aliya. And so in what you're seeing on the Hill, and social workers, as you know, we advocate, and we educate. So how do you see democracy and social work and healthcare? How are you seeing all of that being intertwined?
So I'll start by saying that most people, when they hear the word social work, they think about workers who work with families and individuals and communities to help them cope with the system and navigate the system, and to help vulnerable populations survive. And the vast majority of social workers are engaged in that kind of work. But there is another side of social work called macro social work, which looks at the systems and the resources that are needed. And a lot of those decisions are made in legislative settings, on the state level, local level, and in Congress. And so there's a growing body of social workers who are now engaged in legislative settings and actually now in the political arena, which is relatively new for social work. We've had social workers in politics for a while, but now it's a really focused effort. And so, yes, we're on the Hill. For example, Barbara Lee, who's a congresswoman from California, is a social worker. Started her career as a clinical social worker, and became a congressperson. So by her being on the Hill, she in bringing ideas from the profession to the Hill, we now have a new Congressional caucus on social determinants of health. And unless you're a social worker, that may not ring a bell with you, but we know that health, there's more to health than just taking care of your physical body and your mental health, but that where you live, environment, housing, all of these things are, impact on your health. And so if you don't consider them, you won't be optimizing your health. So by having social workers on the Hill, we're able to introduce legislation, bring ideas that will help create a better, healthy environment for people.
Thank you. Aliya?
Yeah, I want to illustrate the concept, the social determinants of health concept. I work for an organization called Vot+ER. Our founder is an ER doctor in Massachusetts. And in 2019, he saw a young lady who presented in the emergency room as having some severe and acute stomach pain. When they diagnosed it, what they found was that the thing causing that stomach pain was that her stomach was empty. She was starving and experiencing her body going through the process of starvation. And so Dr. Martin sits down with her, asks her what's going on, and comes to find out that her dad's medications are so expensive that she was making a choice between whether she could eat and whether she could take care of her father. That is not a medical problem. That is a social problem. That is a problem caused by issues related to the way that insurance works in the US. It's a problem related to the way that income and workforce development works in the US. And what he found was that so many patients he was seeing were exactly like her, where the thing they were presenting for was a compounded social issue. And what he also found was that the same people coming to the emergency room were amongst the groups less likely to vote or to be registered to vote. Often young folks, folks from lower income communities, folks of color. And what he wanted to do was make it so that he could help his patients even when they crossed outside the door of his emergency room. And that's how Vot+ER started and was founded. And basically what we do is help patients in emergency rooms, community health centers, and other similar spaces get registered to vote, get their mail-in ballot, make sure that they're part of the political process to influence some of the same things that Dr. Lewis is talking about.
Great, thank you, Sarah. Aliya.
I just want to add one thing to that. I think many people have heard that literally you can, there's I forget now what the link is, but you can put in a zip code and you will see that zip codes in the same region, that the life expectancies are different compared, from one zip code to one that's 2 zip codes away based on these social determinants of health. That is not a democratic system giving health access, to our citizens, and this is the problem.
So, as you all know, here at American Promise, we are advocating to pass the next amendment. And, we're talking about, how money is spent in politics and how, that affects everyday citizens and just their basic needs for human life. So a constitutional amendment is definitely a solution to the power of money in our political system, and it's going to take action in every state, every citizen, every community, and just for Americans' everyday walk of life. So in your organizations and in your respective fields, what role do you all see in social workers and healthcare workers? What role do you see in what role do you see take as you all take efforts in making sure that we advocate for what's the dignity and worth of a person, advocate for things like that, just kind of. And I'll start with you, Dr. Lewis.
Okay, so one of the things that drew me to American Promise is this singular focus on getting money out of politics, because obviously we understand that it corrupts the political system, and so with social workers, I think we're in the communities, that are some of them that are affected by it, and we know that from data that lower income communities don't vote, and as large numbers as more affluent communities, because I think they are kind of jaded by the fact that their influence in the political system is not really, they can't see where that they would make a difference. So we try to engage those communities. We have a voting and social work initiative where we go into communities to try and get them to register to vote and then participate in the process. My organization, Chris, we focus a lot on young social workers because we believe that they need to get started and engaged, and so it's so being a part of the political system is not something that you have to think about, but it's like something that like I grew up, I've started voting at 18 and I never stopped because that's what you're supposed to do, but but a lot of young people are not convinced that their vote matters. But there's another thing that I've also been recently doing with social workers, to understand that while money, the dark money and unlimited contributions have corrupted our system, you need money in politics. You can't win elections without money. So I encourage social workers to give to their preferred candidates. Small donations matter. And so we have, because I think among, social workers, they say, well, money in politics is bad, so therefore I'm not going to give any money because I'm contributing to the corruption. But that's, so that kind of misinformation we have to work against as well.
Thank you.
Yeah, for us, the work with American Promise and thinking about the 28th Amendment is something kind of new for us. Transport yourself back to 2020, and in particular, so I mentioned we do health-based voter registration. We shipped thousands of these badges across the country, and we did that with the help of volunteers. One of the volunteers who worked with us back in 2020, when she explained why she was getting involved, I was in Georgia at the time where I'm from. It was just before the Georgia primary. And her husband was immunocompromised. She could not go to the polls without risking his life and his well-being. And so she was sitting there waiting for this mail-in ballot that she was really hoping would come, but that she wasn't sure if it would arrive at her home. And she wanted to do something while she was waiting, so she volunteered to help send healthcare professionals these badges. In 2020, that was the link that our health professionals were seeing front and center. They had patients who really wanted to vote for their voice to be heard, where the number one thing getting in the way was that it could compromise their health. And as health professionals, they felt they were faced with a dilemma that they needed to solve. And by participating in Vot+ER, they were able to help their patients get their mail-in ballots or register to vote without being in person at a Department of Motor Vehicles, and then proceed to be able to vote in the fall. Well, that was 2020. We know how there was record turnout. That was incredible. Well, along comes 2022. And the panel right before us talking about foreign influence, the first thing that sort of jolted all of us this year was Ukraine. And then after that, with the experience of seeing people massacred in Buffalo, in Uvalde, our community is a community that treats people who experience gun violence. They see people in their emergency rooms who have been shot. They have to treat them and try and save them. And what we realized both as a team and throughout our Vot+ER community was that while making sure people could show up at the polls was a critically important part of our work, we were gonna have to figure out how to go beyond that, because that record turnout in 2020 hasn't addressed the fact that there is still such a prevalence of gun violence in America. And so for us, this is about an exploration of another important tool to help address some of the things that our health professionals are seeing front and center in their clinics.
So I want to
add one other
Yes.
thing. The important thing to know as whether you're a social worker or you're a nurse or you're a physician or a physician's assistant or wherever you land in the healthcare profession, we are looked at by our communities as respected members of the communities, and we are strong messengers. We can educate person to person in a clinical setting, and we can educate our other professional colleagues. So, and I think education comes pretty naturally to most people that are in the healthcare profession. We want to help. That's one of the main ways we help our patients, right? So I think it's really important for healthcare professionals. When I first got involved with this, I thought, gosh, I really have never been in politics, and who am I to speak up? And then I realized when you go into congressional offices, usually, especially when you meet with a representative, they don't really know what you're talking. You are much more knowledgeable and have much more expertise on this particular issue than they do. You can teach them and you can lead them along. And so you have a really valuable role. Don't feel like, well, I've never studied that before, I can't help. You can help. You can help in the ways that you already have a wonderful skill set to help.
And I definitely want to make note that Dr. Marie, she leads our healthcare network, and she's doing a phenomenal job with that. And so, you all can find more information about that on our website. But, with her advocacy efforts and her volunteer efforts, she is leading our healthcare network that we have here in American Promise. Sarah, I want to go to you.
Sure. Well, I think, for social workers, many of us are frustrated with the system structure, with the inequality, with the outcomes that we're seeing, with the suffering. And there is a whole movement to change these structures in society. And what we need to encourage them is that we actually need to work within the system structure at the same time that we're advocating for these reforms. And Dr. Lewis alluded to this. And so, there's about 700,000 social workers in the country. I can't emphasize enough how much members of Congress in both chambers want to hear from their constituents. They expect to hear this kind of message from myself or Dr. Lewis or others in the profession that represent these interests. But it really is powerful to hear directly from constituents, even if you don't have all the answers, even if you're just managing up problems. And then we need media coverage. In a prior role, I helped to set up an honorific society for the social work profession, the American Academy of Social Work and Social Welfare. Part of their mission is to inform Congress. These are the experts in our profession. Many of them spend a lot of time in their tenure process writing journal articles with this amazing research. But it never reaches the right decision makers. Or if it does, it's because of a really, hard process of trying to translate those findings. And so what we need to do is get media coverage. We need op-eds, we need pressure. The media creates pressure for action in Washington, D.C. And we're not doing enough of that. Collectively, we need to figure out how to do more of that, because it's amazing. If there's an article published in the New York Times or the Washington Post, a Hill staffer will call NESW or these other DC-based organizations and say, what do you think about this? To what extent is this a problem in our state? And do you have any data on this? It drives their agenda to some extent because they are trying to get elected and stay elected. So we need to think about this if we want to really use our power to really kind of leverage the democracy in our interests.
So Sarah, you kind of led into my next question, and anybody who knows my story knows that I always say that I hate politics. It wasn't until I met Dr. Lewis during my doctoral program that I was introduced to political social work. I was like, oh, what is that? I don't even know what that is. So I always thank him for introducing me to this arena because it's been very rewarding for me so far. But we kind of talk about let's get involved and what we need to do, but how do we go down and reach people who aren't really educated enough about what we're doing? How do we motivate them? How do we get them involved? How do we keep them involved to want to continue to advocate and do the work that we're doing, because this is hard work. It's hard work. So how do we reach other social workers? How do we reach other healthcare professionals? And I'll start with you, Dr. Marie.
I think it's important you all have a network in your profession. Speak to your colleagues. You have to reach out and say, this has come to my attention. It really was bugging me, whatever it is, and I decided to look into what I could do about it. And this is what I'm doing. And, offer them something small that they can do. And the other thing I found really important just in my American Promise work overall is to celebrate the little wins. Don't let them go unnoticed. And when people get that little taste of, wow, I did that, then they're interested in doing something else. And then you have something else to offer them to do, to get more involved, to be, and to write a letter to the editor, to write an op-ed, to call a member of Congress, to meet with a member of Congress, to meet a local elected.
Thank you. Would y'all like to add anything?
Oh, I was going to share. It goes back to something that Jeff said earlier around preparing to win, right? When you're a health professional in today's day and age, there are things that are harder than advocating for changes in reform and democracy. Those things include trying to explain to your patients what are the best guidelines to follow when the CDC is talking out two different sides of their mouth, right? It is harder for them to explain to a patient why they can't afford their insulin based off of which insurance program that they have. Mm-hmm. It is harder to explain to a patient why in the world they should be worried about the costs of certain medications, life-saving medications, because of the influence of different companies, than it is to explain why it's important to get money out of politics. And so I think that for the communities that we work with, they're seeing this up in front. This is a proximate problem for them, and something that they can work on day in and day out as well, because they're seeing it play a role in their day-to-day work.
So for me, it began when I read Nancy MacLean's book, Democracy in Chains. And it was an eye-opener, about what was happening in the country. And so I immediately thought about, well, what are we doing as social workers to address this? And so each March we have a gathering in DC, and for one of the panel discussions, I raised the question, can social work help save democracy? We can't save it by ourselves, but certainly is there something that we can do that would be helpful in saving democracy? And out of it came what we now call a group, a 501c3, called the Social Work Democracy Project. And that project is to inform social workers about threats to democracy and what they may do, how they may be engaged to address those threats. So when I got the opportunity to connect with American Promise, and I heard about this idea to enact a constitutional amendment, I was skeptical. Are they for real?
But it came from me, so come on, I'm just a student.
But the more I listen to Jeff and I listen to what's going on, I'm convinced, right? But with my democracy project, they're not convinced yet. But so I'm not yet preaching to the choir with them, but I am gonna try to bring them along, because I do think that this is something. I give you it's how we think about things, when I was doing therapy, I was a cognitive ecological therapist. It meant that a lot of things are out of whack because our thinking was not in line. So when I brought this to the board, I said, American Promise, man, we got to, and it said, and I got an email from one of my members saying, but they got Republicans involved. You know what I'm saying? That's a good thing. We got to bring everybody to the table. So, we got to get, for me, it's getting social workers to understand the gravity of what's going on in our country and look for ways that we can connect and make things happen.
Thank you. So as we kind of wrap things up here, I want each of you to take a few minutes to talk about some other issues that you are seeing and some other issues that you're advocating for within your respective organizations. Yeah.
So one thought, and this kind of helped us transition into this part of the session, is just that what is the role of national associations that we affiliate ourselves with professionally, and what can we do to try to make sure that they're acting in the best interest of either the issues they represent or the workforces that they represent. I think young people, frankly, don't even fully understand the value of association membership anymore. Mm-hmm. And the criticism is probably maybe even deserved. Some of these organizations have been around for some time. And in my view, they really have a role around directing because they can pressure government in a different way. So if we have an organization and I can say to a member of Congress, we represent 700,000 people in the country, that's different than 1,000 or even, So we have to try to figure out how to get involved with these associations and kind of use that, leverage those organizations to work on these policy issues. These are not matters that usually yield income. They're not profit centers in associations. So we have to say these are the priorities and these are the things that we need to really work for. And then I think we can get young people to join and to work with us. In social work, there's many different social work organizations. I'm a member of at least 6 or 7 of them. That becomes costly. So it's challenging in our profession, but it's a little bit more streamlined in others. Still, I don't think there's an association out there that can't benefit from our participation and leadership. Get on the boards of these organizations to really kind of drive them. In terms of NESW's policy priorities, we have a blueprint that is about 40 pages long that really covers the issues. It's called the Blueprint of Federal Social Policy Priorities. So I encourage you all to look for that document and to support the social work profession in its advocacy.
Yeah, Dr. Marie.
I'm going to pass.
Okay.
So last week, we did our first in-person congressional briefing, and it was on the Indian Child Welfare Act. This is an act that gives tribal entities the jurisdiction on how children, Native American children who have to be placed in foster care or other out of the family placements, they give them jurisdiction because they're concerned that they be placed in in situations where they can maintain their culture and their heritage. So this legislation was passed in 1978, and it's been pretty effective, but now it's being challenged by a court case out of Texas, Burkeen versus v. Halen, and on November 9th, the Supreme Court is going to review the constitutionality of the Indian Child Welfare Act. So we were approached by tribal to help do something about it. So we convened a briefing so that we could raise the awareness of this, and because we now have a different Supreme Court, and we don't know for sure that they will, rule in favor of the constitutionality of this act. And so we brought people, and we had a conversation about what can Congress do should this act be declared unconstitutional. And so we've got several members of the House who have introduced bills to address this should this be written. So that's one way, we bring our social work skills to the Hill.
Thank you. Aliya?
Yeah, for us, it's taking what the social work field has already led in, which is recognizing this link of voting as a social determinant and voting and health and that link, and making that more prevalent within medical and healthcare spaces. And this year we had a really big win with the American Medical Association declaring voting a social determinant of health and kind of simplifying a lot of the conversations that we now have with health professionals and with patients about that importance. So continuing to ensure that the things that the leadership of folks sitting here already deeply understand in their bones translates into the medical field.
Thank you. So we only have just a few minutes left, so I wanted to see if anyone had any questions in our audience for our panel. Yes.
It's all yours.
My name is Boyd Wolford, and I am a social worker from the state of Maryland. And one of the things I found out that I'm a late bloomer, I didn't start to, I'm pretty much new. But what I'm not new at is voting. I've been voting since 1971, every session. But what I'm finding out in the field of social work, we're not teaching the generation about civic engagement. Even our profession, we have a mandate in our code of ethics that talk about political engagement. I never heard about it, and everything is clinical in our profession. So I think that needs to change. You know, we need to start getting more towards the civil engagement and political advocacy, because I do associate myself as a political social worker. But that's what I think is the biggest problem in our profession, is that we're not holding on to our code of ethics that states that we need to be involved, and we're not encouraging future students and people in the social work field to be politically engaged. They think it's two separate worlds they have to be in. So that's my concern, is how can we encourage more schools of social work to engage students in a political advocacy field and let them know it's okay to be a macro student, because most of the time it's, you know, you want to get towards clinical, but we're not encouraging our students to be macro students in the field.
Well, every March is Social Work Month. March is Social Work Month, and we do a Student Advocacy Day. And we bring hundreds of students from all over the country to the Hill so that they get an opportunity to engage the government. And what we learned by doing this is that, you know, the excitement of visiting congressional offices, but what they really want is to get those advocacy skills. So we've been really focused on helping young social workers develop that advocacy.
Yeah.
And
Well, I know.
Yeah.
So,
Well, you know,
But
I
it's
will,
open to everybody.
it is,
Yeah.
and I will say this, that it takes a lot of communication amongst the other, the seasoned professionals, I will say, in the field, because, and like for me, example, letting others know that it's okay to not want to do clinical social work. Yes. I personally have no desire to do clinical social work. I am on a macro track, and I feel like I was kind of at a disservice whenever I didn't learn about political social work until my doctoral studies. You know, so it just, you know, really is going to take communication on the ground level for us to kind of go into these schools, you know, to these colleges and universities and say, hey, you know, this is what I'm doing. You know, can I have the opportunity, you know, to speak with your students, you know, and invite them to NASW and let them know about the public policy initiative, you know, organizations like CRISP and Vot+ER, you know, just to give them more options as to what they can do other than just a clinical track.
can I just say that to you all? So social workers have to do 2 years of field practicum. They do for their foundation year and their advanced year. The first year, it's 2 days a week, full days, and the second, it's 3 days, full days, 2 semesters. We can all serve as field supervisors for these students. I've had at least 4 in the time that I've been at NASW. Several have gone on to have prestigious fellowships in both chambers of Congress. One just finished a fellowship assigned to the Vice President's office in the White House. Okay, and it was because I signed up as a field instructor and agreed to supervise these students. It's not easy to do, but it's not so difficult, and it's amazing what young people can do when they have those field experiences, because you kind of need to experience working in politics and government with political appointees directly. It's hard to learn this for in theory. And so some schools of social work and other health providers offer some of this education, but it's really in the field. And Most schools of social work require you to be supervised by a social worker, but they increasingly have this structure where they assign a task supervisor for supervision, and you can train the person without being a social worker. So we all need to be committed to doing that, and in a couple of years, just a couple of years, you have all of these kind of mentees out in the field and involved in these jobs.
Well, I have to wrap up. That's our time. Thank you, Sarah, Dr. Marie, Dr. Lewis, and Aliya for taking the time to be with us today. Thank you all for attending our session. Thank you all to our live stream viewers. You can visit our website, AmericanPromise.net, to learn more about political social work and also learn more about our healthcare network and also find out more about Dr. Lewis, Aliya, Vot+ER, and Sarah, NSW. So thank you all.